Hi, I'm Bobby Peer with TAPinto, and I'm here today with Dr. Anthony Terrana from Terrana Orthodontics. Welcome, Dr. Terrana.
Hi, Bobby. How's it going today?
It's great. I'm so excited to learn about your new office that you opened up in New Providence in November of
Yes.
2020,
Yes.
opening during a pandemic.
Yes. Great time to open, but
Oh, yeah. So tell me about your office and what is the latest technology with orthodontics?
yes. So our office, what sets us apart is we are completely digital, which I always wanted to do. So we have an iTero scanner, which is basically a digital 3D impression taker. So it's great for people who have gag reflexes. They don't like that traditional gooey, gaggy impression
That
material.
mold that you put in your
Exactly. Like it's so uncomfortable. I personally do not like it, so I wouldn't subject my patients to it. So what we did, we got the iTero scanner. It's this little camera that goes in the mouth and it takes a 3D image. So there's no gagging involved, there's no goo involved. And that image gets sent to Invisalign, it gets sent to the lab, and you could fabricate your trays, your retainers, your expanders, anything you need could be sent that way. And usually by doing that, since it is 3D and digital, the impressions are much more accurate than when you take the putty.
Okay. So that actually helps in the care that
Exactly. We've noticed with Invisalign, trays fit better, which allows teeth to move quicker and patients get done with treatment faster.
which typically if you're in Invisalign, you're
Yeah.
hiding the fact that you have braces. So the quicker
You want to be done quicker. Most people don't complain about that.
Now, I remember having a conversation with you about Invisalign.
Yes.
And that it's not only for adults, that children
Yes. So exactly. Invisalign used to be more towards adults that had treatment in the past. Teeth have moved a little bit and they want to fix it. But over the past few years, the technology behind Invisalign has become so evolved where at this point we could really treat almost any case that braces could typically treat in Invisalign, which means kids now that we would normally say you are not a candidate for Invisalign are using Invisalign, which is great, especially for those high school kids, high school girls. They don't want to have metal in their mouth, right? So they say, all right, mom, we're going with Invisalign. I do not want that metal in my mouth, which I don't blame them, right? So when I was a kid, we didn't have that option. We had to go to school and we just had to do it.
Oh yeah, we just had fun with the different color bands that we put
exactly.
around the metal.
Which now with the Invisalign, you don't have that. But if kids still want braces, we still do it. So it's helpful.
Now I heard there's a new technology with the actual bracket that you
Yes. So what we use here are called self-ligating braces. They're different than conventional braces. With conventional braces, you used to have those color O ties that would tie the wire into the bracket. Now we have little metal doors that open and close, and by using metal doors instead of rubber, it reduces friction. So by having less friction, teeth can move quicker, treatment's done faster. We don't have to see the patient as often as we used to. We used to see them every 4 weeks. Now we're seeing them every 8 weeks, every 12 weeks, which patients love because now they're only coming to the orthodontist a few times a year versus every month. Right? And people these days have such busy schedules with school, with sports, just makes it a lot easier to not have to come here as often.
Now, talking about convenience, your hours seem to cater to children's schedules. So what are your hours?
So we usually have at least one late night a week, open till 7, sometimes 8, to accommodate people who work during the week, can't make it. And we also offer Saturday appointments for other people that are working during the week and can't make it. So we really want to accommodate to people that have busy schedules.
That's great. And I noticed you have the petitions up, so you're still caring, obviously, about the pandemic and safety first.
Yes, we take temperatures at the door. We do a whole health questionnaire. If anyone had a fever within the past 2 weeks, we have to unfortunately reschedule the appointment. But we really want to make sure that there is no COVID here. We wipe down everything between patients. At this point, we're not overlapping patients. We're trying to limit one patient in the practice at a time. So make sure there's no interaction between patients.
Well, let's hope that things keep improving. And
we hope so. We hope so.
But I have a feeling that the partitions and all of that will remain.
That is going to stay. I like the partitions in addition to protecting against COVID. As you could see, it just offers some privacy between patients, so you're not seeing the person next to you. Typically in an ortho office, you're sitting next to other patients and there is no privacy. So here we put partitions, we skipped every other bay, and we also have a private treatment room where adults could go or kids with longer appointments could go. We could close the door and they have privacy.
Okay, I went to your grand opening, so I remember that room. That I would choose that room. Thank you.
That's my favorite room.
Great view of downtown Providence.
Of New Providence, exactly.
Well, thank you so much for your time today. And
thank you, Bobby.
I wish you much success in New Providence.
Thanks, Bobby. Thanks for having me.